Hi guys, welcome back to the new episode on my YouTube channel. So in our today's video, let's quickly talk about Wilson's disease. Wilson's disease is also known as hepatolenticular degeneration. It is an autosomal recessive inherited disorder of copper homeostasis. It is associated with mutation in the ATP7B gene on the chromosome 13, which results in excess accumulation of copper in the liver and brain, to be very precise, basal ganglia, cornea, kidney, and the joints. Moving ahead, let's talk about the clinical features. The clinical changes in liver include chronic hepatitis, hepatic steatosis, and cirrhosis in adolescents and young adults. The clinical manifestations of CNS indicates that liver disease is present and includes speech disorders and various movement disorders like wing beating tremors. So here comes the most repetitive MCQ. In the eyes, Kayser-Fleischer rings in the periphery of the cornea are seen. The Leipzig scoring for predicting the diagnosis of Wilson's disease includes first, serum ceruloplasmin, which is typically decreased by 50% of a lower normal value. Ceruloplasmin is an alpha 2 globulin. Second, 24 hours of urinary copper excretion, which is typically more than 100 mcg per 24 hours in adults. Third, serum free copper, which is typically more than 200 mcg per liter. Next, hepatic copper, which is typically more than 250 mcg per gram dry weight. Next, we appreciate the presence of Kayser-Fleischer ring on slit lamp examination. If the score is 4 or more, diagnosis is established. If the score is 3, diagnosis is possible. If the score is 2 or less, diagnosis is very unlikely. Liver biopsy is the gold standard test. Wilson's disease severity can be established with nasal prognostic index. Now let's move ahead and talk about the treatment of Wilson's disease. Restriction of dietary copper is prescribed. Copper chelating agents are given and oral zinc is prescribed. Now let's solve a few MCQs to understand this topic very well. Our first question is, a 10-year-old boy is referred to the OPD with hepatosplenomegaly and cirrhosis. On examination of the eye, a Kayser-Fleischer ring is found, blood and urine tests reveal an increased level of free copper. Which of the patient's gene is defective in their underlying conditions? Option A, ATP7A. Option B, ATP7B. Option C, HFE. Or option D, ATP7B. Yes, the correct option is option B, ATP7B gene. Now let's move ahead and solve our next question. Which statement is not true regarding the underlying condition of a 14-year-old girl presenting with deteriorating school performance, fatigue, lethargy, elevated urine copper excretion, decreased serum ceruloplasmin, and the following optic finding? Option A, bronze skin pigment may be observed. Option B, it involves mutation of ATP7B gene. Option C, it is an autosomal recessive disorder. Or option D, treatment with D-penicillamine or trientine is effective. So which option is correct according to you? Yes, option A, bronze skin pigmentation may be observed is the correct answer for this question. Now let's solve the last question for today, which is, what is true regarding a 23-year-old man presenting with abdominal pain, tremor, cognitive impairment, yellowish skin discoloration of skin and sclera, Parkinsonian gait, and a wing beating tremor? Option A, councilman bodies are seen in chronic cases. Option B, the stain used is Persian blue. Option C, the condition is commonly associated with diabetes. Or option D, treatment may involve trientine or penicillamines. So which option is correct according to you? Well, yes, option D, treatment may involve trientine or penicillamines is the correct option. So that's all for today. Thanks for watching. And if you have still not liked my video or subscribed to my channel, please do it for more such videos. See you in my next episode. Till then, bye. Take care.